discouraging the judgment comments, ignoring the comments made about the client, reporting the nurse comments to administration, leaving articles about judgment opinion in the nurse report room.
Three, reporting the nurse's comment to the administrator.
Reporting the nurse, okay, comments to the administration.
1.
Now you got it. And I will say 1. And look
Right.
at the question. A nurse leading the medical surgical unit over here, the nursing staff openly discussing a client and stating that the client is uncooperative and real paying care for. The nurse leader will most appropriately manage this issue by, okay, disclosing a judgmental comment. So you cannot, you cannot report it to the next coming administration. Just getting right there in the open scenario when actually the nursing staff is openly discussing, okay, a client and stating the client. So when that happens, the first thing you have to do is number 1, okay, confront. Number 2, discourage the judgmental comments. And then after that, okay, you'll probably report her. But the first thing you would do, and it says the most appropriately manage this issue is to discourage the judgmental comments. And that's, okay, pretty much, okay, the answer. Because reporting the nurse coming to administration is not going to solve the issue at the time it's happening. And this is pretty much what the question is asking you. So you have to make sure when you're answering a question, you understand the time of the question and what it's most important to you to have a positive outcome, okay, from your answer. Okay, and you need to stop, okay, this guy, okay, and continue openly discussing a client, okay, issue. No, it's openly discussing that. No, you have to discard the judgmental comment. So doing that, you're going to stop the action. And that's pretty much what it is. 82. A client receives a fasolin sodium NSAID by way of the intravenous route. During the infusion, the client begins exhibiting signs of an allergy reaction. The client said that the skin is itchy, and the nurse knows that the skin is warm and flush with a red rash on the arms, chest, and back. So on the nurse immediately discontinued the medication. Forward assess the client contacts the physician and begins to document the reaction to an incident report. The name most accurately documents which is the following. The client had an allergy to cefazolin sodium. The physician was notified because a rash developed while the client was receiving cefazolin sodium. The client is apparently allergic to cefazolin sodium and indicated by one flush skin and a rash on the arm, chest, and back. During the infusion of the cefazolin sodium, the client complained that the skin was itchy and the client's skin was warm and flushed with a red rash on the arm, chest, and back, and the physician was notified.
Four.
Perfect. Perfect. That's what you have to document. And it's the most accurately because it's including wherever it's happening, okay, with the patient. And always when a reaction occurs, we need to call the physician. Now, a nurse who works in the medical care unit it is told that the nurse must flow to the intensive care unit because of a short staffing problem on that unit. The nurse reports to the unit
Can you
and
please,
is
can you
assigned,
please,
okay.
We
because
cannot see.
we
And
cannot
it's
see the question.
oh, you cannot see the question? Can you see the question?
No,
Oh,
we
let me
have
go back.
82.
Let me go back and share. So now, better?
Yes.
Okay. So the nurse is hungry and with the assignment because I believe that the assignment is more difficult than the assignment delegated to the nurse on the unit. And because the intensive care unit nurses and each assign only one client, the nurse should most appropriately refuse to do the assignment, tell the nurse manager to call the nursing supervisor Ask the nurse manager to intensive care unit to discuss the assignment. Return to the medical unit, care unit, and discuss the assignment with the nurse manager on that unit.
Four.
No, not 4. What do you think, guys? What do you think it's the answer? 4 now, because return to the medical care unit and discuss the assignment with the nurse manager on that unit.
Discuss with the nursing supervisor.
1, you can refuse it.
Is the second one?
Tell the nurse manager to call the nursing supervisor. No. No, I'm gonna ask you only. I'm gonna ask you only one question. Is mandatory to you as a nurse to float? Yes or no?
No.
It is. It is. It is. It is mandatory. It is mandatory. According to the nursing charter, it is mandatory. And for your Nclex, it is mandatory. What is not mandatory is to accept the assignment. But you cannot refuse. You cannot refuse to float. No.
But you can refuse an assignment, right?
Yeah, you can refuse an assignment. You can say, you know, I'm not feeling safe, okay, for this assignment, but you have to accept to flow. So I'm now right here, just working in a medical care unit, and she must flow to intensive care unit. You know, she's not familiar with that type of patients. And the nurse reports to the unit and assigned to 3 clients. The nurse is angry with the assignment because she believes that assignment is more difficult than assignment delegate to all the nurses in the unit. Because intensive care unit nurses, what the nurse choose, the nurse should most appropriately. So when that happens, the most appropriate intervention is just to go to the nursing manager of the unit and discuss the assignment. Before you report it to the nursing supervisor, before you report it, okay, on to any other person, the first intervention is to look for the manager, okay, and then discuss and say, you know what, I'm not feeling safe with this assignment. Can you change my skills? I'm not enough to manage this level of patient. And they will change it to you. And the reason they have to, because look what happened in the real life. You're coming from medical, okay, from medical care unit for med surg to intensive care unit. What the intensive care unit nurse is gonna do? Hey, Phil is coming from med surg. Let's give the more difficult patient to him so we can rest this night. Let me tell you something. It sounds mean to you, but there is something really true, and there is no friends in nursing. We can be good coworkers. We can be the best coworkers in the life, but when something happens, everyone wants to make whoever is around guilty for their own mistakes. For that reason, you always have to go a step by step. Number 1, nursing manager of the unit. It's not solving the problem. Then you go to the nursing supervisor. Nursing supervisor is not okay solving the problem. Then you go okay to the health department. But this is pretty much what it is. So we ask the nurse manager to intensive care unit to discuss the assignment because you don't feel safe and you cannot leave. If you leave, that is abandonment. Okay, so you cannot do that. When you're refusing to float, it's abandonment. You can refuse an assignment and not to float because that is abandonment. An appropriate discharge approved by you as an RN, abandonment. I can be the doctor and I can call you and say to you, you know what? Patient in 202 needs to be discharged. And you will all that, no problem. But if you actually approve the order without the patient having the enough criteria to be discharged, that is also abandonment. So you have many questions also besides this floating question about abandonment in your test. So you need to make sure, okay, about that concept too. Okay. Any question? Number 3 is your answer. Okay. Let's go to 84. A client with a left arm fracture complains of severe diffuse pain that is unrelieved by pain medication. It's not relieving. It's not decreasing in pain level. On further assessment, the nurse knows the client experiences increased pain during passive motion compared with the active motion on the left arm. On the basis of the best assessment findings, which action should the nurse take first?
One.
3.
Checking to see whether it is time for more pain medication. What you're gonna do in that time? So you're gonna give the same medication the patient is taking, and you will have the same response. And actually, the patient is taking something, it's not working. So what is your outcome? Waiting 30 minutes and get the same painkiller? No, it's not. It's not 3. It's 1.
One.
Contacting the physician. So it means that the painkiller we are giving that it's not working. So we need to make sure that that order needs to be changed. Okay, so we have to contact the physician, and that's your answer. Okay, good. A client with terminal cancer is receiving continuous intravenous infusion of morphine sulfate. On assessment of the client, what does the nurse check first? Morphine sulfate. What is the classification for morphine?
4.
4.
Four.
4.
Okay, 4. Really good. What
An
is the
opioid.
classification? An opioid, right? What is the most important sign and symptom that will tell you that the patient is suffering an opioid intoxication?
Can sedate the respiratory center, and the patient can drop the respiratory rate.
Okay, good. Now let's say that the patient has an opioid intoxication. How do you know in your assessment that the patient is getting an opioid intoxication?
When the respiratory rate is going down, less than, I don't know, less than 8, like 8 or 7 or 6. That is the first sign that you can see in your patient.
Okay, so in order to morphine sulfate suppress respiratory status, it needs to be a huge intoxication. Okay, but let's say that now you're looking at the patient, you're assessing the patient that is on morphine on opioids, and you are suspecting on an intoxication due to an addiction to opioids. What you will see in this guy in your physical assessment?
Confused.
Go to the face and tell me what do you see in the face for someone who suffered addiction and is intoxicated with opioids.
Anxiety.
No. Looking at the
Pupil
face.
size. Pupil size.
Pupil size.
Yeah.
Now, how the pupils are?
Constricted.
Dilated.
Good, 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 good. Now, try to mask. I'm going to the Nclex language, because never and ever believe that the words that you're reading in your books, not even in your word, not even in Pearson, not even in Saunders, will be in your Nclex. Nclex is not subscribed to any kind of review. That's number 1. So whatever review we are doing right now is to practice questions and really close to the style of questions in your Nclex, but they're not the same language. They're not. They're really close, but they don't. They're not using the same language. Now, give me an expression to you in English that will let me know that the patient is having a constriction pupil due to an opioid intoxication? What comes to your mind? How do you believe they're gonna present that answer to you, your question? They're not gonna say to you constricted pupil. What other synonym, what other statement you can give me that pinpoint pupils? And that's what the Nclex is gonna show up to you in your questions, pinpoint pupils. So and pinpoint pupils and unconsciousness and difficulty breathing. But that's the most common three signs and symptoms. Number one, pinpoint pupils. Number two, we are gonna go to unconsciousness. Number three, difficulty with breathing. Pinpoint pupils is really common, okay, in your test. Antidote for the morphine intoxication.
Naloxone or Narcan.
Narcan. Really good. Really good. So we're gonna discuss the question. We're gonna go over some subjects that I know. Okay, it's your test. And nurse is preparing to administer medications to a client by way of nasogastric tube. Before administering the medication, the nurse must first
Check the placement of the
Check the placement of the tube.
check the placement of the tube. Really good. Now, how do you check the placement of the tube?
By
You
the
can,
acid on the stomach.
yeah,
Say that again.
By the acid on the stomach.
Okay.
Between less than 4.
Checking the nasogastric residue, right?
Residual.
Okay, really good. What is the normal gastric pH?
Less than 4.
Less than 4 or 4. Now, let's say that now the patient is having, and of course the question, okay, the answer is what you're saying. Okay, check the placement of the tube. Now, let's say that now you're gonna provide medications to a patient and the patient is on formula. And then when you're checking the residual, it's more than 50 cc. What do you do? What do you do? What do you do first? So patient is gonna have medications be up at 2. You always know that you have to check the residual before you give it. But when you're gonna aspirate the residual, you know the patient have more than 50 cc or residual. What do you do?
Put it back.
You slow down the feed.
Give back to maintain the pH.
What do you do after you, okay, put this on residual back and you administer the medication to a patient? What do you do?
You slow down the feeds.
You hold the formula. You hold it. You have to hold it. You have to hold it and you have to call the physician to decrease the rate of the formula. And the reason you have to hold it is because out of times when you're checking residual, if it's more than 50 cc or 100, you have to hold the formula because the guy is not metabolizing the formula. And as you continue, okay, passing this formula to back to you, that is gonna develop chemical pneumonia. So you need to prevent complication. And that is something, okay, that is including all internal policies of any place you go. That's an intended standard of care for everyone that has EPIC 2. Out of time when they're having EPIC 2 that receives more than 50 or 100, we need to hold the formula and notify the physician immediately. Or they change the formula or we decrease the rate. But we need to have a doctor orders for that. Okay? And that's very common in your Nclex too. That's really common in your Nclex too. Okay. An emergency department nurse is performing an assessment of a client who has sustained 4-inch burns of both legs. What should the nurse assess first?
Oh. We don't see the.
We can't see the PowerPoint.
We cannot see the PowerPoint, Professor.
Now better?
No. Still not seeing.
No, we don't see it.
You don't see the question? Let me share the screen again. I having issues connecting. I don't know what happened with the link. Better now?
Yes.
Okay.
I think it's peripheral pulse.
Really good. Really good. And let me tell you something. Circumferential burns in wherever. Why are you choosing peripheral pulses? Why do you believe that's the answer? That is good.
Circulation.
Maybe the patient has problem with the circulation.
Okay, really good, really good. Now, out of time when you see circumferential burns in the chest and both legs, that will be priority. Priority between your patients. And you know why? Because whoever suffers circumferential burns, it will be a risk for compartment syndrome. And that's the reason we need to assess peripheral pulses. Because they are very high risk for compartment syndrome. And it's really painful. Okay? But it's really good. It's number 3. And right here, you know, we always need to establish a click. Out of time when you have burns, the first 24 hours, okay, it's losing fluids. The patient is gonna have an anuria right here. They're not gonna make pee in the first 24, and then they're gonna have a massive diuresis after the first 24. And the patient becomes completely hypovolemic and dehydrated. So we need to assess peripheral pulses anyway. Okay. Really good. ADA. Nurse employee at the hospital is asked by a nurse to review the organizational chart. The nurse reviews the chart so that he will.
So, twee.
Okay.
Twee? No?
Be familiar with the belief and values of the organization. That is important, but it's asking you, what is the reason you want to know the organizational chart? What is the reason you want to know? How do the administration bodies organize? Why do you want to know that? I mean, what is the reason? Okay, then he's asking for that. So just want to know how is everything is structured. Okay, to who I will command my suggestions, or so I need to know how the commands at the hospital or that settings are organized. Now you got it. I need to be familiar with the organization line of authority. Because usually when you are a nurse manager, okay, or you are a nurse, you cannot go straight to the head. Because they will say to you, do you already speak with your nursing supervisor or with your nurse manager? No, so go back to them and then, okay, talk to me. This is the way it is. So it's number 2, your answer, okay? Now, a physician asks the nurse who's caring for the client with a new colostomy to ask the hospital stomach nurse to visit the client and assist the client with care of the colostomy. The nurse initiates a consultation, understanding, and the stomach nurse will be able to influence the client because of his.
number one, expert power, because she's the nurses of the stomach is mainly the person that know how works better. I don't know. I suppose.
So which one do you choose? Number one?
Yes.
Expert power. That is what it is. Yeah. The question is telling you the answer. Okay. And it's saying it's right there, hospital stomach nurse. Who you are, an expert. Really good. And you will have this type of questions in your NCLEX. And sometimes they're really tricky. Okay, so we need to know. A nurse manager discusses staff empowerment with the nursing team. The nurse manager explains the staff empowerment. Do you know what means a staff empowerment, right?
Yes.
Have
Yes.
to do
Okay.
with the dependence of the staff, no?
Yeah. It's try pretty much to help them, okay, to be independent and to be like more creative and more safe and feeling confident, okay, with what they're doing. This is when you're empowering someone.
So
So yeah,
it's two.
it's number two.
Two.
It's number two. It's number two. It's what you're doing right now. So your husband or your wife is empowering you to finish what you're doing to achieve your goal. And I'm saying, hey, have faith and move forward. That's empower someone. And this is pretty much, okay, what is happening right here. Force the growth over so that they are less dependent on the leader. Really good. Yeah. 91. A client who has an undergone a total hip replacement is told that she will need to go on extended care rehabilitation facility for therapy before going home. Which member of the healthcare team does the nurse ask to plan the discharge and transition from the hospital to rehab facility?
Social worker, too.
Social worker. We have two phrases, right? We have two choices, or social worker, case manager. But then I'm giving you a case manager, social worker. Okay, really good. Now, the nurse knows that a physician has documented the following prescription in a client's record: furosemide Lasix 40 milligram stat once. What action should the nurse take?
One.
Contacting the physician. Really good.
Yeah.
Really good.
Yeah.
Really good. Yeah.
Don't have the root. So
Yeah. Really good. Really good. Yeah. It's amazing that. 93. And a 17 years old client arrived to the clinic and asked to be examined because she believed that she has contracted sexual transmitted infection. In regard to informed consent, the nurse tells the client that.
I believe it's two.
One.
She will need to sign an informed consent form. Okay, 17 years old. And mother and father will need to be contacted for the permission to treat her. No, now I was planning to use something.
It's
And
number 4.
no, no. Yeah, we need to have an informed
Oh,
consent. Okay, for the STD. We need to have that. And give me 1 minute. They need to have an informed consent for that. Okay, and but I will tell you something. When do you consider a minor emancipated? When? Which ones are the criterias? for the minor to be emancipated?
When she's pregnant?
What else?
Married?
Married and over 18 years old, right?
What else?
In the army.
What else? What else?
Dead parents?
STDs. STDs is another one. STDs. Addiction. Okay. If you are a 17 years old patient, you suffer addiction to cocaine, and you want to be in a rehab center, and the parents say no, and you say yes, I will follow what the adolescent's minor is saying, because on that time he's emancipated. And the reason he's emancipated because now he's a risk for the public health. And I cannot keep this guy upside even though he's a minor. Okay, I need to approve the order for rehabilitation. And the same thing for the STDs. As soon as you're having an STD, syphilis, gonorrhea, STDs that needs to be reported to the health department, not the kind of STDs. If you are an HIV, the patient is an HIV patient, he becomes emancipated. It becomes emancipated when we are gonna talk about the treatment for that STD. Okay, not for other situations, but particular for that STDs or for the STD treatments, he's emancipated. I don't need to ask the parents, okay, to sign informed consent. Clear?
But even in this case that she believes she has it, but she hasn't been diagnosed yet.
But she believes that she has contracted sexually transmitted infection, but she believes that because she has an unprotected sexual encounter. That's the reason. You're not gonna believe you have that is you have a safe one. As soon as you believe that you're having a sexual transmitted infection, okay, and of course you believe that because you have an unprotected one, I will say yes, okay, for the STD screening, even though, okay, parents, okay, saying no. I'm gonna give you a consent. I'm not gonna, okay, run the risk that you're being positive and you will compromise the public health and start transmitting that to everybody outside. No. You become emancipated.
Okay.
Okay, and
So
this
the
is
answer is one?
the answer is one. The answer is one. And these are the kind of the questions, okay, that sometimes, you know, are like really tricky. Let me look something for you right now so you will understand. You will understand. And take a picture of this slide. Take a picture. Example, which minor consent is permissible? Can you read it?
Yes.
Substance abuse, sexual transmitted infection, testing for HIV and AIDS, birth control services, pregnancy, psychiatry services, emancipated minor, and court order or other legal authorization. Take a picture. Let me know when you're ready so we can continue with the questions.
Done. I'm ready.
Okay. Yeah, and also you can take a picture of that concept too. Take a picture to that slide too, so do we have that on your record?
Thank you.
Okay, really good. Let's continue with the questions right here. Clear for you now?
Yes, Professor, thank you.
Okay.
Yes.
An 18-year-old client is brought to the emergency department by emergency medical services after sustaining life-threatening injuries in automobile accident. The client is unconscious and requires an emergency splenectomy. A nurse in the emergency department assists in quickly preparing for the client's surgery and tries to contact the client's parent, but is unsuccessful, in regard to the informed consent for the surgery.
One.
The nurse understands that the consent is not needed. Now, how do you classify that type of informed consent?
Imply consent.
Imply informed consent. Really good. Now, let me tell you, there is another type of. That is something different. I mean, something comes to my mind right now that it's really common in your Nclex too. You need to have a good review about management of care. That would be good. And do you know what is the meaning of centennial event?
I'm sorry, Professor, can you repeat that?
Okay, that is common in your Nclex. I will write it. This is really common. I don't know why it comes to my mind. Probably can be one of your questions. So
That's like if the patient falls, then all of a sudden he has MI or something, and it causes his death, or something that led to progressive.
Yeah, it's an unexpected occurrence involving death or serious physical injury or a risk of death of any of these conditions. So the patient unexpectedly fall, and then that cause, for example, a death of the patient or with serious, physical injury in which is that patient becomes completely disabled. When the Nclex ask you for centennial event, this is what they're asking you for. And that question is really related with incident report. So the deal with the question is that when they mention sentinel event, the students are like, what the hell is this? You know? So, and just reading that, and I don't know, for some reason that comes to my mind, but wherever comes to my mind that I can think that it will help you, I will let you know. So it's clear for you now what it means?
Yes.
Okay, and that is really common. It's really common in your Nclex. Continue. Never heard about that before?
Yes, but
Yes.
not so much.
Okay, let's see right here. We are 94, right? Yes. No, 95. A nurse supervising a new nursing graduate in various procedures, which is the following actions by the new nursing graduate constitute a negligent act.
One.
I think it's 3.
It's 3. Using clean gloves to change and gasotomy tube dressing. Yeah, yeah. No. That I need to use an steady one doing that?
Because it's a study procedure.
It is. It is. It is. Really good. And that's a negligent. A nurse reviewing the notes written by the nurse on previous shift, which note in the client's record reflects the correct use of guidelines for documentation.
Two.
Yeah. Which one do you choose?
Two.
Number two. See,
Two.
number two. Which one the client record reflect the current user line? Yeah, the client's intake was okay, really good. Really good. Now 97, and this is reading the nurse practice ad for the state in which she's employing. The nurse uses the information in this ad too.
Two.
For me, it's 1.
4.
And 3.
1.
And the nurse is reading the nurse practice ad for the state in which she's employing. The nurse uses the information in this ad too. What is the reason? Okay, and know how to perform certain procedures. Know that is a standard of care. That is a standard of care. And be aware of hospital long-term care facility policies. No, that is a standard of care. It's not nursing practice act. Nursing practice act changed by states. Okay, and standard of care doesn't change. So it's number 3. Be aware of the role of the professional nurse. For example, if you're going to California, what the nursing practice act states there, you cannot have more than 5 patients, probably. They work with nursing ratios. That is not part of the nursing practice out of Florida. It changed by states. It's not the same. Standard of care doesn't change, but nursing practice act in some states that change. So that's an example. You know, so we need to be aware. The first thing that we do when we move into other state, it's that we have to make sure that the nursing practice out of that state before we start performing anything, any kind of duty at that state. Okay. Clear?
Yes.
Okay, good. 98. A client on whose right leg is in a skeletal traction complains of pain in the leg. Which action should the nurse take first? Realign the client, asking the client to, okay, wiggle her toes, removing some of the traction weights, medicating the client with the prescribing analgesics.
1.
4.
1 or 4. What is the most important priority when you're having an
You have
skeletal traction?
Compartment syndrome.
No.
So you have to assess.
Don't go so far.
2.
Don't go so far. And
Don't move the weights.
2.
no. It's number
You say
1.
that you have to change the
It's number 1.
state,
It's
state
number
of the
1.
patient. Oh.
It's number 1. I will give you a very small synthesis of summary of the skeletal traction. Number 1, pin sites. It's there. Even a skeletal or skin traction, the most important priority to you is that you work with the patient aligned at all times. They need to be aligned at all times. You need to have to make sure that that is going to happen, because if you don't do that, okay, the pain is going to continue even though you give painkillers to patient. Because you're not keeping, okay, the reason we place the skeletal traction and skin traction because we're trying to place this, okay, joint back to the regular anatomical place. Or try to align the joint before surgery will be done probably. But it's we keep it not aligned at all times or displacing the joint from the area. And the pain will continue even though I give you morphine. The pain will continue. So this is really important. That's number one. In referring to skeletal tractions, you have pin side, we have to do always pin care. The pin side care is an steady with a clean procedure. Is pin side care an steady or a clean procedure?
Clean.
Clean.
It's an
Clean.
steady one. It's an steady one. It's an steady one. And it requires normal saline plus peroxide. And that is in your Nclex too. Pin size and steady procedure, and that's the items we need to use. Only that. Normal saline and and hydroxide peroxide. That's it. Nothing else. Okay. Now, Nclex is gonna ask you, what is the counter traction or distraction? And that's a difficult question. But the counter traction on each of the tractions the patient is having or place will be the patient position. For example, when the patient is in Rosa traction, we have to make sure that the heel is not touching the sheet. So we try to keep, the leg completely straight and aligned with the knees semi-flexed pretty much, but the heel is not touching the sheet. When the patient is in Brian's traction and is a child, we keep the child in 90-degree angle, but we're gonna make sure the buttocks are not touching the sheet. And that's a counter traction of those tractions, for example. So for each traction, we need to have a counter traction. And the counter traction, and the reason is counter traction is because the weight of the traction is always gonna pull the joint against the force. And this is how they're gonna keep the extremity aligned. And that against counter forces is what we call counter traction, and it's a patient position. And as a reason, you need to have a picture in your mind about the tractions, because the patient position will be a counter traction of that traction. And the only way we can keep the patient aligned is we keep the patient in the same position at all times. We cannot move it every 2 hours. No. Weights cannot be removed, never and ever. No, they need to hang freely. And in the only situation we remove it is when they're going to remove the traction. Besides that, the weights are not removed. And how do you know the traction is not working? Because the pain continues. And it's probably because the patient is not aligned or it's having a complication.
Okay, that makes sense.
Yeah, and we always need to do neurovascular assessment in all patients with tractions, always. And we use a fracture bedpan when the patient is on tractions, when they're gonna make pee or they're gonna, when they're gonna have bowel movement. If they are independent patients for that, we need to use fracture bedpan. It's not a common bedpan, it's a fracture bedpan. And it's a fracture because the front of the bedpan is flat. So the patient doesn't need to make too much efforts, to be under the bedpan in order to do their needs. And that's what they're gonna ask you about traction in your test. So we need to know. So you have right there pretty much a summary of what we need to know about tractions. So and most make sure you're gonna keep in your mind about the counter tractions. Make sure about Brian's traction. Very common in your test, Brian's traction. Okay, I mean, do you remember that type of traction, Brian's traction? Yes or no?
No.
Okay,
No.
that is really common in your Nclex. And Brian's traction is a kind of the traction we implement in patients with in patient with hip dislocation. And you know how many questions you can see about hip dislocation in your test? Many of them. So I'm gonna type right here how we can write that.
That's for the kids, right?
Yeah, we heat dysplasia. Okay, and look for the position. You will see how both legs are wrapped and connected to a weight, and we keep the patient an angle 90 degree. They will be flat and until weights, and for the weights up, they will do an angle of 90 degree. So it will be okay, pretty much like this. Okay, the child flat until the waist, and then okay, they will do 90 degree angle, and the buttocks never is gonna make contact with the cheeks, and the weights are gonna hang freely. So have that picture on your mind so you will know. And that's really common, okay, for your NCLEX. And it's for heat dysplasia, hip dislocation. Childs cannot weigh more than 30 pounds, okay, in order to do this kind of tractions. Really cute because they having they trying to simulate again with the traction. They're putting in different type of bagons on they're having simulating toys and all these things. Have it right there, really good. And look at the best, okay, right here. You see, buttocks never touching the sheets, and that's the reason. Okay, you see that, okay, mark right here. And that position that the buttocks are not touching the cheek, that's the counter traction. So when they're asking about counter traction, they always are looking for the more particular detail in the patient position during the placement of the traction.
Professor, are you showing us something else? Because we only see the question.
Okay, now when you look at the chart, go to the chart. Someone place a picture there. Okay, you can see right there. So you can see the buttocks right there and the little mark.
We don't see it.
Go to the chart.
Oh.
Go to the chat and it's right there in the chat.
Yes, we see. I see it.
Okay, guys, give me 1 minute because I have an emergency at home. My daughter suffered an emergency. Give me 1 minute. Hold on. Okay, I'm sorry. She applies the cream on his face and then it was burned. Okay. So anyone looking at the chat and you can see the picture right there so you understand what I'm saying to you, okay?
Yes.
Okay, now let's go to the next question. 99. Nurse is performing suctioning to an adult client tracheostomy tube. The nurse note that the client's oxygen duration is 89 and terminates the procedure. Which action will the nurse take next?
4.
I would say 3.
We're checking the pulse oximetry reading. No, when you're having this problem because you need to
4, right?
hyperoxygenate. Yeah, you need to hyperoxygenate the patient before and after suctioning. Okay, so we need to oxygenate the patient, okay, with 100%. Okay, yeah, that's number 4. Hyperoxygenate the patient. Suctioning cannot be more than 15 seconds. There's a problem with the suctioning. The reason we need to hyperoxygenate the patient before and after is because that will suctioning deplete the oxygen storage. So for that reason, okay, we need to hyperoxygenate the patient before and after. Okay, so it's number 4. A nurse is assisting a client with a closed chest tube drainage system in bathing. As the nurse is turning the client on his side, the chest tube is disconnected. What should the nurse, okay, do first?
Number 4.
4.
Yeah.
Yeah, number 4. Number 4. Really good. Wait, give me one. Go to the.
Which is the step after that?
Okay, so now let me look for another file right here. No. Sorry. Okay. Are you able to read the questions?
Yes. Yes, Professor.
And it's skating for the client who's dying, and the client says, my mother died in the hospital, but I did not get there before she died. Which of the following statement should the nurse make?
B.
4.
4. I would tell your family or your consensus that they can be here. Why the family? My mother died in the hospital, but I did not get there before she died. Which of the following statement should the nurse make? Choose something to express the patient's feelings and concerns. Allow the patient to do that. Always.
Is the B as in boy?
Be as a boy. Yeah. So you must make sure she will be able to verbalize her concerns and so doing that, and you will be able to validate the patient's okay on.
Right. Because she might not be afraid of dying alone. She might just be stating that her mother died alone, but she might not be afraid of that. So you have to confirm that that's what she's afraid of.
So, which means that we have to make sure that the patient on feelings, okay, on on verbalized by the patient. That is really, really important. So now, number two, and this is reviewing information about health, insurance portability, and accountability at HIPAA with a new licensed nurse. Which of the following statements by the new licensed nurse indicates a need for further teaching?
A.
A.
And information on the client can be disclosed to family members, okay, at any time. So yeah, and that's the most important, okay, thing. So we need to on, and that's HIPAA. So we need to know. Okay. Okay. Okay, let's go to the next question. And this is skating for the client who's dying of metastatic breast cancer and she has a prescription for an opioid pain medication, PRN. And she's concerned that the administering dose of pain medication might hasten the client's death. What's the client ethical principle should the nurse use to support the decision not to administer, okay, the medication?
B.
B.
Yeah, really good, really good. 4. A charge nurse knows that the staff nurse delegates an unfair share of tasks to the sister personnel, AP. And the nurse on the chief, okay, report the staff nurse frequently leave tasks uncompleted. Which of the following statement to the nurse made to resolve this conflict?
A.
I need to talk about
A.
unit expectations regarding delegating and completing tasks. Really good, really good. 5. And it is reviewing data for 4 children. Which of the following children should the nurse assess first?
A.
A. A.
10 years old child has a sickle cell anemia and reports severe chest pain. Okay, give me 1 minute. I have access to all. Okay. So let's continue. Now, and this is reviewing data. Okay, we already which is the follow. Okay, the next is reviewing data for 4 children, which is the following children to the nurse. Okay, assess first. I was deleting something, making sure you don't have access to that. Okay, we answered that already. Let's go to question number 6. And it's providing care for the surgeon or medical surgical unit nurse from another unit as the nurse about the surgeon medical diagnosis. The nurse responds that he's unable to provide the information requested. The nurse is displaying which of the following ethical principles.
D.
C.
No, not C. C is justice.
D.
It's D. It's D because you are obligated to protect the patient. Okay, confidential information. Okay, so that is a kind of harm. If you release the patient information, you are also okay on heading the patient anyway. Question 7. When planning delegation of tasks assisted personnel, a nurse consider the 5 rights of delegations, which is the following which the nurse consider when using one of the 5 rights of delegation.
B.
B.
The AP has the knowledge and skill to perform the task. Really good. Question 8. A public health nurse is assessing an older adult client who lives with a family member. The nurse identifies several bruises in various stages of healing. The client and family members explain that the bruises are as a result of clumsiness. However, based on the distribution of the bruises, the nurse suspects an abuse. Which is the following action should the nurse take first?
B.
Report findings, okay, to a supervisor. Yeah. Or sometimes they change them for authorities. It's the same. This is caring for a client who refuses treatment and asks to be discharged from hospital against medical advice. The nurse notifies the client provider who tells the nurse to restrain the client, if necessary, to keep her from leaving the hospital. The nurse understands that restraining this client will be considered which is the type of civil action by the nurse.
C.
D.
No,
D.
not C, it's D. It's
B.
false imprisonment. It's
D as in
false
David.
imprisonment. D as in David.
False imprisonment.
Yeah, when you go find a patient at the facility against the patient will, that means, okay, false imprisonment. Question 10. While caring for the client who experienced a needle stick injury, which is the following action to the nurse take first?
C.
C. C.
C.
C.
C.
C as in cat.
Yeah. Okay. Question 11. This is skating on for a client who has named a person to serve as his healthcare proxy. The client is taking his clarification on this type of bonds directive, which the following statement of the client indicates a need for clarification.
C. I have to choose a family member as my health proxy.
Yeah. Yeah. Healthcare surrogate proxy. Really, really important. Really important. It is serving as a continuous quality improvement committee and has been assigned to develop programs to reduce the number of medication administration errors following a sentinel event at the facility. Which is the following study should the committee plan to initiate first?
C.
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 C. Review the events leading up to each medication administration error. So yeah, after any sentinel event, the first step always would be try to analyze what caused the mistake, what causes the issue. Yeah. Yeah. Okay, and next, a charge nurse has access to the facility electronic client records. It is appropriate for the charge nurse, okay, to share his personal password with him.
B.
B.
No one.
No one.
1-4. And also the medical units reconciling a newly admitted client's medication. This is reviewing the process of medication reconciliation, which newly licensed nurse then it should include with the following information.
B.
Purpose of the medication reconciliation is to prevent adverse medication reaction. Really good. Now, this is scanning for the client on the medical surgical unit. The client has been taking warfarin at home, and her lab values reveal her iron in 3.5. The client states that she's checking herself out of the hospital and refused to wait until her provider can discuss the situation with her. Which is the following action to the nurse take?
C.
C.
C. Explain the reason the client faces, okay, just leaving the hospital. And that's really, really important. What is the normal INR for patients in comedy?
2 to 3.
What is the
2 to
normal
3.
INR for patients in comedy after a heart valvular replacement? Nclex question. Understand the question?
Is it supposed to be double with the regular INR?
Not double. What is the INR for patients in comedy after a valvular heart replacement? (2.5 to 3.5). It changes from 2 to 3. So you need to read the subject of the question carefully. And sometimes they said to you the patient has, okay, a valvular replacement, a heart valvular replacement, okay, and that in comedy, change the INR from 2.5 to 3.5. And that's another Nclex question too. What is the best value for the APTT in patients on heparin?
Bleeding risk.
Do you know what is the APTT, right?
Yes.
Okay, what is the best value for the patients for the APT for the APTT in patients with heparin?
60 to 80 seconds, something like that. 60 to 80.
Seconds. (60 to 80 seconds). Really, really good. Antidote for vitamin K. I mean, for combating, okay, vitamin K. So, yeah, really good. They're going to ask you all these things. The National Medical Surgical Unit is planning to delegate tasks to an adult volunteer. Which of the following task should the charge nurse avoid assigning to the volunteer?
D.
Yeah, post-operative client who's confused? No. An assistant personnel tell the nurse manager that you observe a nurse on the unit on a small amount of morphine from syringes prior to administering the medications to client. Which is the following action to the nurse? Okay, the nurse manager tell you first.
A.
I think it's C.
A. For me, it's A too.
It's A. We
B.
need to, yeah, it's A. because we need the first thing to do when any allegation it's made, it's to look for information, making sure that allegation it's true. 18. And this is skating for the client has severe head injuries and he's declared brain death. The transplant coordinator has spoken with the client family about organ donation. The client's spouse states that she's confused and does not know what she should do. Which of the following responses by the nurse is appropriate?
B.
B.
B. What do you think your spouse? Okay, you have one. Really good. 19. This is nurse manager is reviewing the Good Samaritan law with a group of newly licensed nurses. Which of the following statements by the nurse manager is appropriate?
A.
A.
It's A. It's A because in the only example you will render A an accident is when rescue, for example, arrive to the place. And another competent person has to take over. Okay. Hold on, because my daughter applied something in her face and becomes burnt. My goodness. Gosh. These teenagers is gonna kill me. Okay. And good. The next is skating for the several clients for which the following situation to the next complete an incident report.
C.
C as in cat.
Diaz and Cat, yeah, client discovered that his dentures are missing. Really good. And staff has applied for a promotion. The hiring manager insinuated that there was a sexual relationship between the two of them, and as promotion request will get an increased consideration. Which of the following action should the staff nurse take first?
A.
A.
A. Tell hiring nurse in clear terms that his conduct was feeling really good. Nurse in a long-term care facility has assigned a task to assistant personnel. The assistant personnel refuses to perform the task. Which of the following is an appropriate statement for the nurse to make?
C.
I need to talk to you about the unit policies regarding the client assignment. Okay, really good, really good. And this is scheduled for the client who's participating in a research study for experimental chemotherapy medication. After the treatment, the experimental medication is discontinued due to the evidence of rapidly advancing kidney failure. The nurse should understand discontinuous medication demonstrate which of the following ethical principles.
B.
The same. Do not harm the patient. Really good.
B.
Now, autonomy. Ron, are you on 23 or 24? Is that on 23? Autonomy is wrong. It's D.
Not
And the reason you stop that because you don't want that medication to continue on hitting the patient, That's what it is. 24. This is skating for the 17 years old client experiencing relapse of leukemia and is refusing treatment. The client monitors the client receiving treatment. Which of the following action should the nurse take?
Is it B as in boy?
Yeah. Notify the provider about the situation. And that's really important. And let me tell you something, after 14 years of age, you're still You're still and being responsible for the patient consent. But
Yeah.
when the child say no and the parents say yes, they need to have an agreement before you proceed with the procedure. Because on a child that is 14 years and older, they already know, they're very mature to understand what they want to be done with their body. So we need to also count with the adolescent's decision before we make an intervention. So both parties needs to be agreed. And that occurring no children's older than 14 years to 18 years of age. You will have to get questions about that in your Nclex too. Okay. 25. Next over here to assistant personnel from the medical surgical unit discussing an hospitalization client while in the cafeteria. Which of the following is the priority nurse in action?
A.
Yeah, it's not appropriate. 26. A nurse accidentally administered the wrong medication to client, which results in severe allergy reaction and prolongs the client hospitalization. The client could roughly sue the nurse for which the following.
C.
C.
Not B, C, malpractice. It's malpractice, really good. Yes, actually make a mistake. Yeah. And it has to be a task to delegate to an assistant person. I want you to follow in touch with the nurse, ask the AP to perform first.
A.
They don't take ABGs. That's fresh water. C.
I think it's C.
Pass fresh water to the client of the unit? No.
B as in boy.
For me, it's D.
It's A.
No, it's A.
Hey.
A.
They can
Yeah.
take the ABG to the laboratory. Yeah.
Yeah, they can do that. That's not a
Oh,
problem.
to the laboratory. Oh, okay.
Yeah,
I thought
they
it was
can
like them
transfer.
taking the ABG.
Yeah, they transfer that. Just remember that all samples that you will transfer to the laboratory need to be in a biohazard ziplock. It's another thing sometimes they ask. Okay.
Oh, because it asks which one first. Yeah, yeah.
Yeah. 28. A male nurse is assigned to care for a female client who was admitted to hospital for treatment of injuries following a domestic abuse incident. The client told the nurse manager she does not want a male nurse as her caregiver, which the following nursing responses, to the nurse manager made.
D.
I can review the assignments and arrange for a female nurse, for care for you. On yeah, that's good. 29. And it is caring for an adult client who's on terminal illness as a ventilator dependent. The client is alert and oriented and he wants to discontinue use of the ventilator. The nurse should be aware that continued treatment against the client, which is a violation of which of the following ethical principles.
B.
Autonomy. Really good. Really good. Terry. A nurse, inexperienced licensed practical nurse are caring for a group of clients. Which of the following tasks should the nurse delegate to the RPNs so that all that apply?
C,
C, D,
E,
E,
initiate, no. I
B,
don't think
C,
LPN
D,
cannot
E.
B,
initiate,
C,
right?
E. B, C, E.
Okay, B, C, E. What do you choose?
BCE.
E? There is
B, C,
someone
E.
who choose D. No D. LPNs, they don't initiate anything. Just
No.
remember that. Okay? Just remember that. Okay? Now, question 31. And this is scheduled for a client who's scheduled for surgery. The nurse role in regard to phone consent is which of the following?
D.
D as in David.
Client who fell and broke his hip while being assisted to the bathroom, but the nurse stated he plans to sue the nurse. The nurse should know that in a legal proceeding, the standard that will be used to determine if the nurse was negligent in which of the following?
A,
B, another staff nurse provide testimony about how reasonable prudent nurse will be handle the situation, I think. Yeah.
Okay. 33. And this is an acute care setting serving a committee whose churches, okay, is to use the outing process to client care. Which of the following aspects of the client care is measured by a process of outing?
C.
C,
E.
Okay.
for me is D.
Plan of the facility stay and cohort client that it's run. Acute
is C, is the
services,
quality of
is a
nursing care
quality
provided.
nursing care provider. Because that process evaluate the quality of care, okay, that nurse provides, okay, and also determining on if the nursing are consistent with established policy, is they are following the policies. Yeah, it's not it's letter C. Yeah. Following a tornado, nurse the determining which of the clients assigned to her care being discharged to free up beds for injured clients. Which of the clients should the nurse recommend for discharge?
A.
Yeah, it's not very written. It's not very written. It's not, it's just stable. Really good. And next in the psychiatry unit is admitting the client who attacked a neighbor. The nurse should know that the client can be kept at the hospital after 72 hours whole is over for which of the following conditions?
A.
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 A,
Yeah, it's A. The client is a danger to herself or others. Yeah, really good. 36. And this is scanning for the client who's preoperative. The nurse signs as a witness on the client consent form. The nurse signature on the consent form indicates which of the following.
B.
B.
Confirms, okay, the client appears competent to provide consent. Really good. And it has been reassigned from her regular area of work to a unit that is a short staff, which is the following action to the nurse take first?
A.
Very good. Very good. A nurse manager hears on a staff nurse on the unit speak openly about her dislike on a recent policy change regarding client care. When discussing the issue with the nurse, which of the following statements by the nurse manager is appropriate?
A.
A.
Let's talk about your concerns about new policy. Really good. Really good. 39. A nurse is caring for the client who falls in his room. After the nurse assesses the client, notify the client provider and completes an incident report. Which of the following action should the nurse take?
B.
B. Submit the incident report, okay, to the risk manager. Really good. Really good. 40. A volunteer assigned to the pediatric unit reports to the charge nurse for an assignment. Which of the following assignment is unsafe for the volunteer?
D.
A.
Infant who was admitted for group.
A.
No. Yeah, because
A.
group is really stable. It's A. Transporting school age client in the truncheons and all department. Really good. It's A. A co-worker puts an arm around the nurse and says, I bet you are a great lover, which of the following is an appropriate response by the nurse?
C.
Speaking to me like that makes me uncomfortable. There, they need to make it weird. Okay, that they don't, yeah, about that. 42, the nursing provider office reviewing lab findings for the client's care for surgery. Which of the following finding requires follow-up by the nurse?
B.
B. B. B.
Yeah, platelets
Bracket.
count, okay, 60,000. Yeah. When the platelets count are at risk for bleeding. What is the platelets count? Will let you know the patient is at risk for bleeding.
Less than 1,000
Platelets.
150.
Less than what?
There's no
Less
150,000.
1,000.
Okay. And less than 20. Less than 50, you have to implement bleeding precaution. At risk for bleeding, less than 20,000. The patient is gonna bleed at any time. Okay? 43. And it is working with an assistant personnel to care for a group clients in the pediatric unit. Which of the following tasks should the nurse have on an AP perform first?
D.
Check this if the elbow restraint is in place for an infant who's operating from the surgical correction on the cleft palate. Really good. Really good. Cleft lip, cleft palate. Very common in your Nclex. This is caring for a group of clients and they demonstrate adherence to the ethical principle of fidelity by doing which of the following.
A.
Keeping an appointment, yeah. Wherever you promise. 45. A charge nurse is anticipating the admission of 4 clients and planning their room assignments. Which of the following clients should the nurse assign to the room closest to the nursing station?
A.
A client who had injury and is having previous confusion. Roll again. All confused patient always need to be close to nursing station. Okay, it's really important. And then head injury also risk procedures, you know. And this client need to be close because they need to have close monitoring. And that's one of the reasons. A nurse participant is an exact simulation in which a toxic substance is released into crowd stadium. Multiple clients are transported to the facility. Which of the following activities will be the lowest priority for the nurse?
C as in cat.
Transferring a client to the discharge location. Really good. Really good. 47. And as a medical unit, surgical units providing care for a group of clients. The net should delegate collection of which the following specimen to the assistant personnel.
D.
B.
D as in David.
Ahora sí, Díaz and David, really good. 48. An external medical unit preparing to contact provide about the client's condition. The client 6-hour postoperative from a total hysterectomy. The next of the client, postoperative oxygen saturation is 94 and apical rate is 110. The nature include information about the client oxygenation saturation level and hurry, which is the component of the SAVA report.
A.
No.
C, assessment.
Assessment. Everything you have right there is subjective finding, assessment. Really good. A nurse manager is reviewing the admission history of 4 adults who were admitted to the medical surgical unit during the shift. Which of the following situation is the nurse required to disclose information to an outside agency about the client or the client's circumstances?
C.
No. A young adult client admitted for an acute on a Friday following a viral infection. That is normal.
I think it's A.
A. Depending
A.
adult admitted for the treatment of spinal fracture. Yeah, it's your depending and you have a spinal fracture. Spinal fracture means like someone turns your arm or the joint, and that spinal fracture is always a symptom of use. Spinal fractures in adult, resting fractures, pretty much in children, Curling's fracture, in children too. 3 of them, signs and symptoms of abuse. Okay? And it's referring to administer soap enema to a client has constipation. And then explain the procedure. The client states, the doctor didn't tell me I was supposed to receive an enema. Which is the following nursing action is the most appropriate at this time?
A.
A.
Check the medical record for the provider's prescription. Really good. And I suspect that the co-worker is diverting opioid analgesics, which is the following is an adverse effect of opioid medication.
A.
Euphoria. Really good. It's one of the most common ones. 52. And it is getting for the client has an advanced lung cancer. The client's provider has recommended hospice service for the client. Which of the following statement of the client indicates correct understanding of the hospice care? They will change that in your test for palliative, but the same.
I think it's B.
Yeah, B.
The nurse manager has received information from the facility risk management department that a former client is pursuing a lawsuit. The nurse manager should anticipate that the deposition will be required during which phase of the legal process.
B.
For me, C.
No, it's B, discovery phase. Discovery phase, because discovery phase, okay, in that phase, both parties, attorneys and plaintiff, are looking for relevant information. So doing that, okay, they will have facts, and in that, okay, discovery phase, they include witnesses. So it's down. Deposition, and deposition means looking for evidence and looking for witnesses. That's what it means, deposition, okay? Next, caring for the client is scheduled to have surgery. Preparing the client for surgery, which is the following action is considered outside the nurse responsibility.
B as in boy.
Okay. An assistant personnel comes to work with a new set of artificial nails. The nurse takes an AP to a private location to discuss the issue. Which of the following statement by the nurse is appropriate?
A.
Really good. Really good. There is a higher risk of infection for our clients associated with artificial nails. Really good. 56. A nurse in an emergency department is caring for the client who has compression fracture on the spinal vertebra. During transport to the facility, the client was medicated with intravenous morphine. On arrival, the nurse surgeon determined the urgent surgical intervention is indicated for the fractures. Staff members have been unable to reach the client family. Which of the following action should the nurse anticipate the neurosurgeon taking?
A.
A. Involving the client consent.
Really good. Really good. 57. And this is studying clients in an urgent care clinic. Which of the following clients should the nurse have the provided care for immediately?
C.
Yeah, it's diaphoretic and report epigastric pain. You know, it's that one. It's that one. Okay, it's that one. And it's referring to bath a client. Which is the following action should the nurse plan to take?
A.
Yeah, privacy always. And this is the medical surgical unit has accepted transfer to the intensive care unit. Prior to transfer to the ICU, the nurse completes an online critical care and majestic nursing course. The nurse demonstrating which of the following ethical principles.
D.
See, the same. A charge nurse is working an assistant personnel who provide excellent care to clients and is an effective team member. Which of the following actions should the nurse take first to recognize the AP contributions to client care?
A.
Yeah, really good. This is caring for the client who's dying. The nurse should incorporate the principle of maleficence into the practice by taking which of the following actions?
B. C.
No harm.
C.
Really good. That will
C.
provide more harm than benefits. Really good. Really good. And then assessing a group of clients for hospice services. The nurse should recommend hospice care for which of the following clients?
Is B.
Yeah, terminal, right? Terminal cancer. And this is skating, okay, on for adolescents who has a history of violent behavior, and she asked the nurse to keep confidential information on the desire to kill several classmates and a school teacher. Which of the following responses by the nurse is appropriate to give?
B.
B.
Really good. Really good. Really good. Next is scheduling for a client who is confused and uncooperative. The client hit the nurse when she attempted to give him his medication. Then I asked the charge nurse that she can't restrain the client. The charge nurse should tell the nurse this action is a violation of the client's rights. An example on which is the following.
False improvement.
D. Yeah.
Really good. A nurse or medical surgical unit is assigning tasks to an assistant personnel to the following task the nurse delegate to an AP. Select all that apply.
B.
Mm-hmm.
D and E.
B, D, E.
D, E. Yeah.
A, D, E. Really good. Really good. And nurse is planning for 4 clients and assigning tasks to licensing assistant to licensing practical nurse. I'm sorry, an assistant personnel. Which is the following to the nurse assigned to LPN?
C.
Reinforce teaching always. And they were initiated, but they always reinforce. And this is writing clients in the emergency department, which is the following client to the nurse asked to the provider to take care of first.
C.
Epiglottitis. Epiglottitis. Really good. Really good. A nurse, okay, is assessing 4 clients on then 4 clients in a medical surgical unit, which is the client should the nurse care for first.
B.
B. Yeah.
B.
B. Compartment syndrome, right? Yeah. And it's a scheduling for the client who scheduled for an elective surgical surgery, which is the following action to the nurse take regarding informed consent.
B.
Witness on the client sitting. That's your job. That's your job. 70. And nurse is providing care to a client on a strict bed rest following surgery. The nurse assists the patients to bedside command and the client sustain injury to the operative area, which is the following type of torts has the nurse, okay, committed.
C.
C.
The nurse providing care to a client who's on a strict bed rest following surgery. The nurse assists the patient to the bedside command and the client sustain an injury to the operative area.
It's battery.
That's B, negligence, right?
That's
Being
negligence. That is
negligent.
failure to provide the expected standard of care. It is negligence. Okay, it is negligence. Okay, guys, gonna stop for today. So next week we are gonna start. We're gonna start with management of care. We're gonna start. Okay, with on infection control and safety. Most difficult question. Not okay. Little complicated level. So, and then doing that, we're gonna complete that category. You're really good right now in what it is management of care. But in order to complete that category, we have to go to safety and infection control. Little bit about that. Okay, and that will be next week.
Thank
Okay.
you.
Have a great
Thank
night,
you.
everyone. Bye bye.
You too. Bye.
Thank you.
Bye.
Thank you.